100 million doses, that's enough for only 50 million people.
A slow rollout to the two-dose vaccinations. Across the RGV, we've seen lines at majority vaccination sites, and we're just in the second phase.
Probably be in this phase until mid to late April, maybe as long as early May.
Vaccination rollout is broken down into those who need it the most. Tier 1A is for frontline workers like doctors and nurses, and 1B is for seniors and people 16 and older with a higher chance of dying from COVID-19 because of pre-existing conditions. John Kraus is UTRGV's Dean of Medicine and says they vaccinated 10,000 residents, but thousands more are waiting.
Right now, where we simply do not have the doses available for all the people who want them.
Across the state, just over 2 million are protected against the virus. In Cameron County, Dr. James Castillo says more than 20,000 people have received their first dose of the vaccine. To grow that number, he says the problem isn't the manpower, but the actual vaccine.
Vaccine remains at the current rate. It might take months to get through everybody in those risk factors.
He's hoping the approval of the Johnson & Johnson vaccine will be another tool to get more shots into arms.
Make a big difference for how quickly we can get through all those people with risk factors and get to the general public.
This is a marathon, not a sprint. It's very important that we're very, very patient.
Growing confidence that by the summer, supply will meet demand.
I would hope to see that, more than 70 or 80% of people in the county have received this vaccine. The higher we get, the closer we get to, the true version of herd immunity.
Putting local first in Harlingen, I'm Jeremiah Wilcox.